Good morning, everyone. Glad you're here today. Thank you for joining us. I hope everything's going well for you. So again, as always, please share your information on chat. We want you to get to know each other. We've got a networking session coming up in a few weeks, and that'll give you a chance to get to know each other in person. I'm so excited that Suzanne Webb, the CEO of Exclusive Surgeries Solutions, is joining us today. Again, we're in webinar format. We do that so that we can tape the program. And we've had up to 1,000 people watch the show afterwards. So we're growing there. And please do join us for that networking session on June 25th. So just quickly, want to let you know what Purse Power is. Purse Power is working to help women use their massive purchasing power to drive positive change. We believe that if women who make 80% of all purchasing decisions would choose to buy from the companies that actively promote women, and we do that in mass, and we could create a funding stream for battered women's shelters in the process, we could shatter glass ceilings and change lives. So that's what Purse Power is all about, what we're trying to do. And our calls, we're trying to link everybody with each other. I'm looking at the attendees today. I see Jennifer Grigsby. She's one of our investors. So thank you, Jennifer, in particular, for being here. So I'll introduce Suzanne. Please, again, introduce yourselves on chat, and then we'll ask questions a little later on in the broadcast through the Q&A block. Okay. Suzanne, you've been in the healthcare industry for a long, long time. We were just talking about that a minute ago, where you got access to a lot of training that a lot of folks haven't more recently because of it. So you were with Universal Health Services, which was a large hospital management company, one of the largest in the US. And that's where you learned about healthcare, right?
Right.
Okay.
Yep. Yeah, I was very fortunate to actually start working with them as they were a very young company. So Alan Miller, who started that, actually was with HCA, left to start Universal Health Services. And so I think I was employee number like 35 to 40 that was hired. So it was really on the ground, really learning everything about how hospitals work. I mean, we were much more on the acquisition and running of the hospitals, but then I actually, years later, actually got to go to one of the facilities and actually run that. And that was where I fell in love with money and fell in love with how do claims get paid? How do providers stay in business? What do you have to do in order to kind of win that game against the insurance companies? So
this is going to be a really interesting conversation. So you've been with several healthcare providers. You've had your own companies that you also have grown a company, sold it, and started another company. So we're going to talk about that here in just a second. So as I understand it, Exclusive Surgery Solutions is a surgery benefit for self-insured employers, and you're focused on building a bundled surgery product. So you vet surgeons, you track outcomes, and you save people money is what you do, from what I understand. Okay. Yeah. All right. So why don't you go ahead and tell us a little bit about yourself and your background? How'd you get here?
Basically, I got hired from Universal Health when I was young. Actually, got introduced to them. I was actually bartending a party, and one of the CPAs were leaving, and they're like, "Hey, you did a really great job." Well, I had done bookkeeping and I owned a restaurant prior, so I had the experience. But it was funny because Alan Miller hired everyone from the hospitality industry because he realized that most jobs, you have to be in customer service. You have to take care of people. And if you get that and you're someone that can do that, then you can excel in any business you do because everyone's got customers. And so it was a really good thing to learn early. But yeah, that's kind of how I got here. I also took advantage of every training I could go to. So as I was telling you earlier, we used to get trained by Blue Cross, by United Healthcare. I actually got trained by the insurance companies as to how to get paid. And so that's what really happened after, I think, the 90s, 96, 97, they stopped doing all those trainings. So now it's illegal. You can't be told how to get a claim paid, but I was actually in the system before that. So I know a lot of things that other people just don't know with what the rules are, what the guidance are, how do you actually work within their systems. And so that's a big advantage that I've had. So that kind of helped me. And when I did the billing company, that was 100% of the knowledge that I trained all of ours. We hired everybody with no experience and trained them as to how healthcare really works. We were able to have a 98% collection rate across the board for all clients, 4 or 5 years, 6 years consistently, because we knew how to play the game better than anyone else because of what I could teach them.
Very interesting. Okay. All right. So tell me a little bit more about your starting Exclusive Surgery Solutions, your mission, and how you made that transition.
The big thing that I noticed after 2012, 13, when Obamacare kind of got launched, was that a lot of the doctors were leaving the industry. I mean, I'm talking hundreds in Phoenix that I personally knew were all leaving. And so I really wanted to, one, save board certified doctors and keep them in business. So we started paying them more money. In our bundle, I save money because I don't use the hospital. I use the ambulatory surgery center or outpatient, and surgeons make more money, normally double what they would make from somebody else. So when they ask, how are you building a large network? I pay the talent more. Like it's an easy decision for a doctor to say, well, I could do this surgery and get paid $900, or work for e-surgeries and get paid $3,200. It's a simple thing, and it encourages them to be board certified and to actually be the best doctors. So we are creating the only network in the country that is 100% board certified and vetted that they're only doing specialties that they're certified to do, which no one else has done. As a matter of fact, when United Healthcare tried to do it in 1984, that was their big premise. We're going to get all board certified surgeons. Within 6 months, they stopped. They're like, we can't. There's not enough of them, and we just can't find them the doctors that we need.
I'll be darned. All right. So I want you to talk for a minute about the benefit to, we've got primarily business owners and business leaders in our audience, the benefit to them, and then also the benefit to them as consumers of healthcare.
Okay, so I'm going to step back a little bit and just say the reason we have insurance is all about reducing risk. That's what insurance companies are for. It's to reduce your risk when you go, and that's the same with your property insurance or your car insurance. It's all about risk. What we do that's different is, one, when we work with the employers, we don't charge an employer to add our plan. You can add us for nothing because we get paid only when we work for you. So only when I do a surgery or behavioral health. Otherwise, we're just part of your network to help your staff and answer questions. And so that's what makes us different. We don't do a PEPM. We're not charging. As I always tell everybody, I have to kill and eat my lunch. I have to earn it. It's not just given to us. So we're more proactive, and we really are all about getting the doctors and getting everyone to communicate and getting better information from the patient. So we're a whole concierge service. We take the patient by the hand. We get all the imaging, all the records, everything that we need to, and then we give that to the doctor. So when the doctor is seeing the patient, he or she has everything they need to know about the health of that patient and what the problems are. And so that's the whole history behind everything. And my mission is to just give more data to doctors. Doctors are brilliant and they are wonderful at what they do, but so often they don't have enough time to dig into what the real problems are or to understand the patient enough. And that's just reality. So we have to give them more information and really be proactive in those things. So for small employers, the biggest thing that they would want to do, so if they want to add our benefit, it doesn't cost anything to add it. It gives you that option that if you do have high deductibles or you can't find a surgeon, you can call us. We do. So a lot of times we get phone calls from all over the country. I had one from West Virginia yesterday, and they're like, there are no doctors that will take our insurance anywhere.
Wow.
And I was like, okay, so that's why I'm here. A lot of doctors after Obamacare actually said, I'm dropping insurances. I'm not going to use them. I'm going to be cash, or I'm going to be out of network, and I'm going to get paid more. And so it really is there's a whole bunch of places, even in California, where there are lots of insurances that all the doctors have dropped because they just said they're going to pay them too little. And doctors are smart. They're like, why should I do the work and get paid $60 when these other payers are paying me $125? I'm not going to take the $60 one anymore. And I think that's something that people have to really look at. It's not that the doctors are trying to be difficult. They just need to get paid. They need to have a fair living. And so, yeah, that's part of our whole philosophy, is just to be able to keep good doctors, keep them wanting to do surgeons, and giving them the time to do enough because I'm paying them more. I've seen the drastic side when I had a doctor up in New York, and it was awful. He was one of the best knee doctors in the entire country. He was great, but he was getting paid $8,000 a knee. Good money. He only had to do 100 surgeries a month. Life was good. The insurance company came in and said, we're dropping your reimbursement to $2,000. The doctor now does 50 surgeries a month, hates his job, hates what he's doing, hates patients, because now he can't catch up because they took away the money for no reason. It wasn't like, let's gradually take you down, or you're not doing as good a job, we're going to, change your pay. They just went in and cut it. And it was his biggest payer. And so he didn't have a choice. But now he doesn't even like being a doctor. And so it's like you took a wonderful doctor, and because of reimbursement, he now hates his job.
Yeah.
That's what we're trying to solve. Is I want surgeons that love their job. I love healthcare. I love helping surgeons. I love helping patients. And a lot of doctors feel that way, but when they get disenchanted, they'll quit. And that's this doctor actually is quitting at the end of next year, and he's only in his mid-50s. And I was like,
Wow.
you guys destroyed him. You destroyed a wonderful surgeon who had gone to all the right schools, wrote tons of papers, actually was one of the best surgeons, just because of finances.
And we're really impacting patients and the quality of care patients can get. Okay. Let's see here. Okay. So someone's asking, I'll go ahead and ask the question now. Ellen Graham says, does your service work for Medicare patients?
No, it does not, because Medicare is a different entity unto itself. So you really have to be a Medicare provider and follow their rules. So we are strictly for employers, self-insured employers.
Okay. Okay. All right. So you've been on this entrepreneurial journey for a while. You've gone down a couple different roads. Tell me what you wish you would have known at the beginning. What would have made it easier?
That's always a two-sided question, because you're kind of like, you learn so much when you make mistakes.
Sure.
That it's like, I don't want to take away, because some of my added products and things that we did was because of things that I didn't know to make the product better. I think if I had really understood how health brokers worked, or insurance brokers, because I really thought they knew something about healthcare, and they don't. They know nothing about healthcare at all. All they know how to do is to sell Cigna or sell Aetna. They don't know what they're actually doing and what you get. So one of your questions was, like, for a small employer, how do you know if the benefits you're getting are any good? Like, is it what you need? And I would say, ask your broker to actually walk you through 3 scenarios: an orthopedic surgery, a child, like a person having a baby, and someone who's got like a heart condition. How is this plan going to pay those out? And where can my employees go? That way they have to find out some answers for you, not just, oh yeah, everyone takes it. No hospital system takes everything these days. It's completely changed. Even Banner here in Arizona, they are owned by Aetna. They take Aetna. You can't get there if you have Blue Cross. You can't get there if you have Cigna. And so the hospital systems don't have to take any insurance if they don't want to. And they can drop out of all of them if they want to. So that's something that people really need to understand. No doctor is forced to do anything. Because of our approach, we can negotiate with them, but all negotiations happen prior to surgery, not after surgery. So a lot of people go, oh yeah, we can take care of that later. No, if it's not done up front, it doesn't work. So it's all pre-negotiations, pre-determining what you're going to pay. When I first started, it was funny. The doctors would be like, you told me, like, I billed $3,500, you paid me $3,500. I'm like, yes, what we talk about is what you get paid. I don't play that game of, oh, well, now I'm going to pay you $1,600. I said I was paying you $35, your check is $35. So doctors love it, because now they're like, wait, when I bill $4,000 here, I only get paid $800. So really getting doctors to understand how their money works, so that they can actually start really asking for it and do better negotiations for themselves.
Yeah, that's interesting. Both of my sisters are doctors and are business people, but that's a little different than most. I know. All right. Let's see here. So how has the COVID impacted your business? How has it impacted doctors and healthcare?
Oh, it's destroyed it. It's just, I mean, I had a couple doctors luckily in New York that kept working, and we had to completely pivot. So we basically in March had, I'd like to say, about 50 surgeries all scheduled for, we get paid only when the surgery happens. So it's not like we had any reserve. So they all got canceled. So we're like, okay, that's fine.
Man.
In May, I got a phone call from someone who's trying to get surgeries done for tort attorneys, because tort attorneys have to have the surgeries done for their cases to go to court. So they're like, hey, we've got a backlog. No one's doing anything. And 3 other companies referred you to us. And so we're calling to see if you guys could do that. So because we started doing tort work, we were able to make it. We actually billed close to about 7 million last year and did fairly well. But it was because we pivoted. We just were like, whatever comes to me, we're going to take care of whatever we can do to help. We did. So we were very fortunate that way.
Okay, so have you got any learnings that might be applicable to most people about the pivot that you made?
The pivot, so what are you talking more about like selling the company?
Well, let's see here. Okay, so right now I was talking about the COVID pivot.
Oh, okay. So yeah, so COVID as a whole, it is something that it's really what's changed everything. People don't want to go to hospitals anymore because they are afraid of going there. So I've been preaching for a long time to go to ambulatory surgery centers because there's no infection. Almost zero infection. Hospitals have MRSA. They have other germs. You can get sicker at a hospital when you go. I think we all know that, but we kind of feel like, oh, our hands are tied. Most good surgeons work at ambulatory surgery centers and hospitals. So when the scheduler is doing the schedule, just say, I'd rather go to the ASC if I can get on that day for schedule. And they can do it. It's really the scheduler that's controlling. who has surgery at the hospital and who has surgery at the ASC.
That's an important thing to know. Okay,
yeah,
so
it's really simple. It's simple to say, when does the doctor work at the ambulatory surgery center? And they'll say like Tuesday and Friday. Great, put me on for Friday or put me on Tuesday. The scheduler is the one that's making that determination. And
okay, and but what that is that's a standalone surgical center. I mean, talk a little bit about what that is.
Standalone surgical centers actually have been around a long time. They started like 1971 actually here in Phoenix, but they are, I always go, I love the ones that are owned mostly by surgeons because one, the surgeons have to be better. They have to be board certified. At a hospital, they do not have to be board certified. At an ASC, they also have a lower infection because there isn't anyone else coming there. You come with one person to drive you home. There's no visitations. You have your surgery, which is a beautiful, regular surgery room that you have at the hospital. But at the end, you go home. Like you're wheeled out, you go home. If they do need home services, we have everything go to their home. So if they need like home health nurse, or if they have some needs, you can still take care of it. You don't need to be in a hospital setting. And so that's where even the population of people, like even now employees are like, I don't want to go to the hospital. Do I have an option? Because I don't want to get sick. And because of how everything happened with COVID, people are still afraid. They are deathly afraid to go somewhere to do things. And that's not going to change. As a matter of fact, our behavioral health side, so we do both surgeries and behavioral health, and we use residential treatment centers all over the country, is actually booming because people for the first time have gone through a traumatic event. It was a traumatic event for everybody, and they don't know how to deal with it. So knowing that that's what people are going through, we're able to get people to the facilities they need to get to actually let them know that you have to get coping skills. You don't have them. Let's help you get those coping skills. That's what residential treatment is all about. Getting people the skills that they need to go back to their life. They're still going to have anxiety. They're still going to have to deal with it. But now what's the healthy way to deal with it to rejoin society?
Well, I hadn't even thought about that. I mean, how COVID would have impacted that population hadn't even occurred to me. Yeah. Wow. Okay. I'm sure it made it much worse. Okay. So how do you see the healthcare industry changing? I mean, it's really changing. And also with all the new technology that's coming out and 5G and all of that, what do you see?
I see from our vantage point, every single thing is going to become home-based. Everybody wants to stay at home, which means you have to have more of the medical devices. You have to be able to, like when I do visits, I have to have like I have to check my blood pressure. I have to be able to get on my scale. I have to give the vitals because the doctor still needs the vitals to know what's going on with you, right? I need to know, are you currently having a heart attack? What is your blood pressure? Like all of those things. And so a lot more of the devices that are available now you can get, which is good. We also have a lot more home testing. So you can even test for colonoscopies now. Like instead of going and having a colonoscopy, you can actually just do that at home. There's 4 different companies that do it. Every blood work and everything that you need can actually come to your home. Last year, I was dehydrated and struggling, and I actually had a nurse come and give me an IV right in my home. And a lot of people are doing that. That's actually one of the busiest businesses that are starting, is going to homes and helping people, especially with health concerns, give them an IV, give them vitamins, give them things that they need, but all of the care is being provided at home. So with us doing ambulatory surgery centers, we're on that forefront to say, yes, we're going to have you go to a surgery, you're going to go home. We're going to still keep tabs of you. We're still going to watch you, but it is healthy for you to go home now. And so that's really where I see it. Same with basically, I would say all the changes. So the big change with even telemedicine, I think the hardest thing is that the patients couldn't get enough information to the doctors, and all the doctors and all the telemedicine companies I've talked to, they're like, we don't have enough. And so one of our new products is actually going to do that. It's going to get all of the records that patients have and put them in one source. So you can actually go to your phone and say, okay, all of my records from all my doctor's visits are here. I can send them to the doctor right now in a PDF. He can review them and actually treat me properly because he's got enough data. And that's really where the change has to be. It's got to be more data driven, but we need to collect all the right data.
How about insurance? To your point about insurance, both from an employer standpoint and from a patient standpoint, what do you see coming?
It's a difficult world out there. And I'll be honest with you, only because there's a lot of companies promising things they can't deliver. So for the last couple of years, there's been something called a reference-based pricing model, which says that we're going to pay a percentage of Medicare. And so that's great for hospital outpatient and for ambulatory surgery centers because they have a Medicare fee schedule. Inpatient does not have a Medicare fee schedule. So you can't do anything as a reference-based company if the patient had an inpatient procedure. If you go to the hospital, there is no Medicare fee schedule. There's like 19 different things that are put in to calculate a Medicare stay. It can't be done. It's not something you do claim by claim. It's actually adjudicated normally through a company. But I just want to tell people, like, if you're an employer and you're being told something that you think sounds weird, like, does it sound weird that a company that's not an insurance company, not a healthcare company, is going to go in and dictate to hospitals the lowest reimbursement for any of the commercial carriers? It wasn't logical. It's like, why wouldn't Blue Cross get those same kind of rates if you can get them? Why wouldn't United Healthcare get those rates? And the truth of the matter is, no one's getting those rates. They sold a product that didn't exist, and then patients got balance billed, and it's just been a nightmare. And it's all because employers were kind of told they could save a ton of money, and they were going to get service everywhere. And that's, anyone that tells you that that's what's going to happen doesn't know healthcare, because nobody can go into every place unless you're paying cash. Then yeah, you can go everywhere. I mean, Mayo doesn't take insurance except for a very few. So it's not like you can just go anywhere you want. So that's kind of the misnomer. I think for employers, have them go through an example, like I said, of the different surgeries that are out there, and say, what is my employee going to experience when they need to have a surgery? Where are they going to go? How easy is it for them to get in? Like, tell me a little bit about how I can use your product. You will have them work harder, but you'll get something you can use.
Yeah, very good. You're a consumer ultimately. Yep. Okay. All right. So if we or someone we love needs surgery, what should we be looking for to get the best possible outcomes in particular? And what do you and your family avoid?
So I avoid the hospitals at all costs.
Okay.
Now, I do a little bit deeper dive. Every hospital has to fill out what's called public health records. So you know exactly what the infection rate is for each department of the hospital. And everyone can do this. You can go to your state website right now. It's out there, public information. And you can actually say, what is the infection rate for this facility for general surgery? And they'll tell you. It's right there. So that's some easy things that you can do to avoid going different places. Other than that, when you get a doctor's referral, look him up. Look him up online. Is he board certified? Does he have a license? People always laugh at me when I say, oh yeah, I do this full vetting. I have probably met 50 or 60 doctors in the last couple of years that were not ever doctors. They never went to med school.
Oh, they had
yeah, literally practicing medicine for years. And they're like, well, no one ever asked. No one ever checked this information because I took the lowest payment from the insurance companies, and they just wanted someone to take care of the patients. And I'm like,
oh my gosh,
you're a cosmetologist. You basically like know how to make people look good. But I literally have found cosmetologists that are doing surgery. Even here in Arizona, dentists can do surgery. Dentists, half the plastic surgeons out there doing work are actually dentists. They are not plastic surgeons. They're not board certified.
Holy smokes. I had no idea. Oh my gosh. Wow. Okay. That's surprising.
So that's where I said, just vet everyone. Get the doctor's name, Google them, check all of their boards. So if you're not quite sure if they're board certified, so if they're an orthopedic surgeon, go to the Orthopedic Association. Are they listed? Like, it's not hard these days. It was hard years ago. It's not hard these days. You can look this stuff up fairly quickly. And you can also call and say, I want to know more information about the doctor. I want to know where to go to school, all this different stuff. You can get it all now. It's all, actually, they have to give it to you because there's laws passed to protect consumers.
Yeah, it's amazing legally that they can do this if they aren't board certified, or at least whatever. I don't know what the classifications of certifications are, but
they can't take Medicare or Medicaid. But if people want to come in and pay them cash, or if they get in with some of those HMOs that are just looking for a low price or an Obamacare plan, then they're like, basically whoever we can sign up, we're going to send patients to. And I was like, guys, that's scary. That's one, it should be illegal. It's not, but it's scary. And, you know, I've been in healthcare for a long time, right? I grew up in healthcare, so I love it. But there are things that we're supposed to do, like do no harm. When I worked at a hospital system, we all took that oath. We're all part of the system. We all have the same oath. We do not do harm, right? And so that's something that I think it's kind of getting lost through the generations, but that is the premise that everyone believes. No one's going to harm me in healthcare because there are protocols and there's things in place to protect them.
Wow. Wow, that is a surprise. That really was a surprise to me. Okay, let's see here. So what do you recommend to small business owners and individuals, like we've got solopreneurs and consultants and things? How do you stretch your medical dollars?
One, like I said, I would have everyone put us on the plan just because we're free and you've got flexibility. You can do things now because we go around the system because we're not an insurance company. So we have other rules that we have to abide by, but we have more flexibility. Other than that, really look at what you're doing. There are so many plans out there now where the patient has to pay $10,000. I've seen plans yesterday in network, $17,500. Okay, so your employees can't use that plan. You're better off not having insurance and letting them actually save that money or do something like that. There's lots of creative things that are out there now. I would definitely not advise going to like the Christian share groups like the MetaShares and some of those others where they just take money and then they want you to negotiate. Those don't work at all. Those are terrible for, because people can't negotiate with the hospital. Like you can't just go in and say, I want to pay you $4,000. What do you think? They'll laugh you out of there. So it doesn't work. You want to go with a good plan. HSA plans are really good because the patient does have to pay the $2,750, I think was last year's limit. I'm not sure what the limit is this year, but after that, then they have a better benefit. Mm-hmm. So it's just, once again, it's numbers. Insurance companies look at it and say, most patients only spend $3,500 a year. So we're going to make that what they have to pay out of pocket, and then we'll cover more. So everything is just done on averages. And so that's really what you're looking at when you get those things. But really look at the fact, like, because we can override the benefit, we get a lot of the plans that have high deductibles because they know they can use us. So we get all the patients and we take care of all the surgeries because then the employer pays 100%. So they don't charge the deductible and the copay, which gives that flexibility to the employee to actually use the benefits. There's nothing worse than having money taken out of your paycheck and then not being able to use it.
Oh my gosh, I know. We were paying $2,100 a month for Obamacare with a $6,500 deductible. It was like, okay, I don't understand the point here of this insurance.
And actually, that's what I would tell everyone before they even get insurance. And I tell all young people the same thing. It's like, actually keep all your receipts for an entire year. And same for Medicare. Before you actually go on Medicare or anything else, keep all of your receipts. When you get to a point where you're going to spend more money than what you spent the last year, then you start looking for insurance. So that's why even with a lot of healthy young people, it's like, really, what's the worst thing that can happen? Would you be able to get, this much money? Like if it is $7,500, but really understanding your finances and understand that healthcare 100% is all about the math. If you don't do the math correctly, or if you're an employer and you're paying a lot of money, go to a different type of plan. There are thousands of plans out there. Nobody is limited. You could go to the self-insurance. It's SIA is the abbreviation, SIA.org. And actually you can look up all kinds of options that are out there for small employers and things that they can do.
That's a very useful tip. Thank you very much. Okay, you guys be thinking of your questions. Go ahead and put them in the Q&A block. Let's see here. I'll ask one more and that'll be your turn. Okay. What is the biggest mistake you see employers making in controlling their healthcare costs?
Letting the brokers do all the work and just accepting what the broker gives you and just saying, oh yeah, I'll take that. That sounds great. When one, it's too expensive and it's going to be a hardship for you as an employer. But then two, you need to look at, can my employees get services now? So we had to switch actually from a Blue Cross plan because our hospital systems in Phoenix are now mostly Aetna. So we had to go to an Aetna plan because I could not go to over half of the hospitals if I had a different insurance. And so it's really knowing what's in your area and making sure that for the large hospital systems that they take your insurance. So I would actually do that before I'd ever sign on any kind of document for your insurance and say, okay, I just called over to St. Joe's, whatever the hospital is, they won't take this. They're the biggest heart hospital in our area. What do I do? And actually let the broker then look at the plan and say, okay, I really need to put you in a different product and really make them work. Because so often they just go out and sell the same thing. And they're like, oh, no one ever asked me. I just always sell this. And I was like, it's a horrible plan. Why? And they're like, well, because no one ever says no, and I make more money on that plan. So just remember, brokers make money off of what they sell you. They will give you whatever brings them the most commission. We can't fool ourselves. They don't care about your employees. They're never going to meet your employees after open enrollment. They'll do whatever pays them the most money. And that's just a fact.
That is a really good point. Okay, so guys, please do add questions. But that's the thing. I used to do benefits as a human resources leader, and I remember that. And what should you do when you are dealing with a broker to make sure that you understand exactly what they're being paid?
Ask them. It's actually now, it was passed actually when it just got passed recently that brokers have to tell you how they get paid. So you can ask your broker, so how do you get paid on this plan? And if he goes, well, I don't really want to talk about it, then offer me something different. Because that means you're selling me the Cadillac plan. So for a while, all of my employees were in their 20s and early 30s, right? I owned a billing company. Everything was, computer skills and everything else. And I was like, we didn't even have a birth in 5 years. Like nobody had any health concerns. So we were able to actually just use basically what I now use as e-surgeries. We just took care of that ourselves because we didn't use insurance. And yet all the employees got what they needed because we just paid it 100%. So there are things that are out there like that. You just want to look at your employee base and go, you know what, would that really work if I didn't have insurance and I offered just a flat amount that I could pay everyone? A lot of employers after Obamacare came out actually did give employees enough to get onto the Obamacare system. And that's how they handled it, just because it's got to be affordable. You're a business owner. You can't go broke trying to give benefits. It's a decision each company has to make individually to say, this does work. We can now offer benefits or we can't. And I know the first 5-6 years that I owned a billing company, we didn't offer the regular commercial benefits until we actually were making enough money.
Okay, so what are some other options? Guys, please do ask questions. What are some of the other options if you're not going to go through a broker and get a full-blown plan, but you do want to provide some support for your employees?
There are companies out there like ours. Like there are companies, I mean, I would definitely, if you've got that question and we've got a small group, send me an email. I think it's actually, if you want to send out my email to everyone, and that way you can just ask me your questions, or go to esurgeries.com. We have a comment section. Ask your question. Tell me what your concerns are, what your ages are, and I'll be glad to help you.
That's wonderful. I mean, it's just so impactful right now. Okay. Let's see. I'll give you guys another minute here. Let's see here. So the people that I'm seeing on work for other people at this point. I guess I've got a few business owners here. Any other questions that we ought to be asking? Let me ask you one about the selling your businesses. Would you please talk to me about exit strategies and any thought process people need to be going through if they've got a business of their own to be ready to sell when it's time to sell?
So when we sold our billing company, it was kind of bittersweet. As I told you, we had like a 98% collection rate for all of our clients. Like we just were that good. When we sold it to another company, we really hurt our clients because they stayed with that billing company because it was sold, but they didn't get the results that they had been accustomed to getting. And so it really was something where we did not know the value in our market because we didn't do enough homework. And we didn't have a broker that sold only billing companies or sold anything in healthcare. So really know that the person that you're working with, because like I said, if they had looked at our numbers, said, okay, wait, we need to make sure that whoever buys you has to have a very good, rigid system in place to keep those numbers as high as they are, or they're not going to keep those in those groups, right? And so that's kind of what we went through, was just we didn't have the right broker working with us. We did get a good exit. We got 4 times multiplier. So we did have a positive exit there and it was fine. But at the end of the day, I wish I hadn't sold. I was like, you know what, guys, I didn't need that money. We're making great money. I would rather have kept my groups happy and kept bringing money in until we found the right buyer. And we didn't really do enough homework.
Okay. All right. So is there great resources for doing that homework or thinking this through?
I think you have to just ask the broker that you're working with, what other companies have they sold that's like yours, and what has been the effect 5 years later, not a year, because we were still involved a year and a half later, because they kept us on and helped with everything. So everything was going fine. But really know yeah, you just have to do more homework. It's kind of like anything. If you were selling a restaurant, you wouldn't want someone to come in that only worked at McDonald's, right? Because they're not going to know how your restaurant runs. They only know how McDonald's works, right? That's not a restaurant. So what you want to do is actually get people that are buying that are actually in your space. And that's the one thing I've heard from other people that also sold companies of different types. It's getting that all important broker. I think we were so happy that somebody wanted to actually buy our business. We were like, hey, this is great.
Yeah, sure.
And we didn't really realize how much we outdid the rest of our competition because we weren't looking at what the other companies were really doing or what their numbers look like. And so it's really making sure you get a fair evaluation, but that you also make a good decision. I mean, at the time I would have said, no one's received the numbers that we have. We're not going to sell because we are a unique product. We're not going to give that up now when we weren't aware of that at the time.
Okay. Okay. All right. So is there anything that you're doing with your current business in terms of structuring yourself so that you're ready someday?
Yeah, we do everything is structured now, like 100%. Even when we're doing our app, like we have all of our provisional patents. You want to make sure that everything is set up early so that you can exit. So we haven't put very much debt on the company. We're trying to do as much as we can to keep it debt free, except for our investment. My husband and I put money in to start it, but really just keep all the books and everything clean so they know that this is the financial model. This is how we make money. This is what we do. And a lot of companies, even I help. As a consultant help, a lot of people are like, what is your product? You need to get that first. Like, what is it you do that makes you different from all of your competition? And if you don't know that, so that's one thing. Now I know we're the only company like this. There's 3 companies that have tried to copy us, but they actually got it from a presentation that I did or a webinar that I did back in like 2015. It's keep everything. So I wish I hadn't told people everything I was doing, because all I did was create competition. If I had kept it a little bit more under the vest, like we do these things differently, it's an internal billing process, I wouldn't have gotten copied as quickly. But I was so excited that we were doing something that helped people. I didn't think of the other side.
Oh, sure. No, fair enough. All right, fair enough. All right, one last shot at questions, guys, and then I'm going to ask her to summarize. All right. Okay, well, why don't you go ahead and tell us of all of the things that you've experienced. You've been a business owner. You've done very, very well. You've sold a business. You're in the healthcare field, which is really important. What are kind of the key learnings? What are the things that you want us to have learned from you today?
I think the most important thing that everyone needs to know and understand about healthcare is really how it works. So I'll give you a case in point. I'm working with a friend of mine has a business, and one of his employees was going to go, she needed cataract, she needed detached retina. So doctor's like, you have to come in tomorrow, you have to get this done. And so she kept calling saying, well, am I in network? And she's going to a big hospital system in Texas. And they're like, I don't know if we take, she had an HMO. I don't know if we take your insurance, but we'll treat you like you're in network. So don't worry about it. Absolutely red flag. Nobody can override a claim, because remember, when you submit a claim, it's a computer talking to computer. If your ID number doesn't come up as being in network, you're out of network. There isn't those kind of things that hospitals want to be nice. Oh yeah, we'll work with you. No. The people up front are not to lose a patient. So receptionists and everyone else is to keep you coming for your surgery. At the end of the day, you're dealing with the billing office. They have strict guidelines and strict rules, and only charity can be done at certain situations, and really understand what you're doing before you have the surgery. Do your homework, know exactly what's going to happen. I was able to, and this is something that everyone can do, I was actually able to go and give her the Medicare outpatient price for a detached retina. I said, go to them. It's $3,633. That's what Medicare would pay them for an outpatient procedure. That's where you negotiate from. She got it to, they doubled it to 7,200. That's what she paid. She probably would have gotten a bill for 50 grand if she had not done those things.
Wow.
So she paid up front, was able to put the 7,500 because her deductible was 7,500 anyway. And so she can take that receipt now and actually file it with her insurance company and have it applied to her deductible. So she's not out anything, but now they're not looking at a $50,000 bill. They're looking at, you already paid me. I can't charge you anything else, because that's what the prepayment is all about. So that's a lot of what we do. We do a lot of prepayment, because then you've got no recourse. You took it ahead of time. We negotiated, you got your rate. There is nothing you're coming after. And so I think that's also where a lot of hospitals are going to start turning to, is really what can we do and get today that's good money, where we don't have to bill. I don't need to fight you. And, it's not going to take 90 days for me to get your money. So for a cash flow standpoint, as a CFO, I'd be like, I want a third of my business cash. I want a third of the people to come in and give me cash for operations today, instead of waiting 90 days for me to get my receivables.
Oh my gosh. And the cost inside a company, again, my sister has a practice that she sold. It's very expensive to administer all of this. So great point. Okay. Anything else on learnings?
Actually, just even right now, no matter what business you're in or what you're doing, I took advantage. And the reason I could do so much in healthcare that a lot of people didn't do, I went to every training I could. So whatever industry you're in, go to all of your trainings, learn as much as you possibly can so that you will be that expert, whether it's manufacturing or hotel, whatever your sector is, whatever you love to do, be the best. Work as hard as you can to know as much as you can and do as good a job as possible, and you'll always be successful. Don't take the shortcut. So I see so many young people that are like, well, I don't really want to have to learn that. You must learn it all. You may not need it all, but you need to have it in your toolbox. If it's not in your toolbox, you can't do it. So just learn as much as you possibly can. I probably listen to 3 webinars a week still to this day, just because there's always things changing. And I want to make sure that I understand exactly what's going on in healthcare and what do I need to change now to make me prepared for the next 2 years.
Fantastic advice. That is really good advice. All right. What actions would you like us to take?
I would ask everyone to just be proactive. Really look at your insurance now. What kind of coverage do you have? Are you utilizing it? So that when you do go next year to renew, maybe you decide to do something different. Because if you haven't used you didn't use your insurance at all during COVID, right? So that whole year was a wash. If this year you're really not using it very much, really look at that. These are big. I know even for our employees, I think we take out like $900 a month from their paycheck for benefits. And if they're not utilizing them, then that's money they could spend somewhere else. So really understand how you've covered today and look at the worst case scenario. Like, what's the worst thing that's going to happen to me today? If you're in a car accident, your car insurance is first, not your medical. So remember, you've got car insurance coverage. So if you're saying the worst thing is a car, then that's not medical, that's car insurance. Really know where your limitations are and where you've got coverage. So if something were to happen to you, you know where to go.
Okay, that's your policies. All right. Do you have any final words of wisdom that you'd like to share on this topic?
I share this with everybody that I do. Do something you love. I told all my children, do something that you would do for free, and then you'll always be happy. So I've got 3 daughters that are older. All 3 of them run their own company. They all, one's a CPA, the other one runs a billing company, the other one is all consulting and management. They're all extremely happy because they're doing what they want to do on their own terms. And I think more and more people want to be self-employed. They want to actually at least make enough to cover themselves, even if they don't hire employees. And if you work hard, you'll always be able to sell yourself and make a living at it. And I think more and more people are going that direction, but you've got to do the hard work. Like when my daughter was going to school, she's like, I think I should be a CPA. I'm like, get licensed as a CPA. You have much more value than if you just are an accountant, right? So try to get as much education as you can in whatever field you're in so that you can be the best person and be a great hire. You know, if they hire you for marketing and you're great at marketing, you'll always be in business. So really look at those things. I think our world is changing so quickly that if you're smart, you'll always do well, but you've got to actually work on that and always make sure that the client is getting a better deal. So it's always got to be a win-win, but the client and the customer has to feel like they got the best deal. And as long as they feel like I won in this scenario, like when we did collections, our collections are the highest of any other doctor I know, they won. And that's what we have to do. We have to really take pride in our delivery.
Yeah, boy, great reminder. Really great reminder. All right. You've been terrific, Suzanne. Thank you so much for being here. I really appreciate it.
Oh, my pleasure.
All right. Okay, so I just want to remind everyone what's coming up. So on June 12th, we're going to have the former Oklahoma City Mayor, Mick Cornett, on, and he helped this city lose 1 million pounds. So we're going to be talking to him a little bit about health and leadership and some other things. On June 18th, I've got Gail Messman. She's the Chief Service Officer, and actually you may want to get with her with Carrie Loop. So she's coming on. And then June 25th is networking. I'm super excited about a guest on July 2nd. Gil Whitty Collins, the author of Why Men Win at Work, is going to be on our show. So thank you again for being here. If you don't have a directory listing and you are have a business that you're the female president or CEO, or the company's half owned by women, or you've got at least 20% women on the board, we want you on our directory. We've got a snapshot report now on our site where you can get an evaluation of you in cyberspace. Please take advantage of that. That's free. It'll tell you how you look and where the holes are in your cyber presence. Let's see here. We are looking for sponsors for this program. If you know of anyone who may have an interest, and then please do buy from women-owned and women-led businesses. We've got the power to make the change if we'll just buy together. Please share our social media pages. Invite your friends to this broadcast. Again, every Friday at 10 Central. All right. Any final words of wisdom from you, Suzanne?
Nope. Just enjoy life. Just have fun. Enjoy life. Enjoy what you're doing. You've done,
Yeah.
I really appreciate everything you've done to create Purse Power. It's a marvelous platform.
Thank you. Thank you so much. All right. Thank you, everyone. Have a great week. We'll see you next Friday.
Bye-bye.
Take care. Bye-bye.